Hi, this is Dr. A. In this medical terminology video on the lymphatic and immune systems, we are going to look at the diagnostic and therapeutic procedures. All right, let's start with some clinical lab tests. So the anti-nuclear antibody test, or ANA test, is a blood test to diagnose autoimmune disease, especially lupus. The presence of antibodies indicates the immune system is attacking the body. HIV antigen antibody immunoassay is a blood test for the HIV that detects both the HIV antigens and antibodies to HIV. The antigens can be detected shortly after exposure, and then the antibodies can be detected within 8 weeks. And so this is it's been the test now for HIV. The monospot is a blood test for infectious mono. So let's look at some diagnostic imaging. Lymphaangiogram is an X-ray record of lymphatic vessels. Lymphangiography is the X-ray that is taken of the lymphatic vessels after the injection of a dye. So the graphy is always the process of getting the record, the X-ray, whereas the gram is the actual X-ray. Magnetic resonance imaging, or MRI, is an imaging technique that images soft tissues and those images are created using electromagnetic energy. When exposed to the magnetic field, the nuclei in the body's atoms emit radio frequency signals, which is really cool if you think about it. Allergy shots are a medical procedure. They're an immunotherapy in which a regular injection of a tiny amount of an allergen is administered, and then over time the sensitivity to that allergen is reduced. Immunotherapy is the injection of immunoglobulins or antibodies to treat a disease. And vaccination is the exposure to weakened pathogen or a portion of the pathogen to stimulate the immune response. The person is then able to fight off the pathogen on subsequent exposure, which and that whole process is called immunization. So some surgical procedures. Adenoidectomy is the surgical removal of the adenoids. Lymphadenectomy is the surgical removal of a lymph node done to test for malignancy or spreading of cancer. Splenectomy is the surgical removal of the spleen. Thymectomy is the surgical removal of the thymus. And tonsillectomy is the surgical removal of the tonsils. And lastly, we have pharmacology. An antihistamine is a medication that blocks the effects of histamine that is released during an allergic reaction. Zyrtec and Benadryl are examples of antihistamine medications. A corticosteroid is an anti-inflammatory hormone. It is used to treat autoimmune diseases like prednisone and sodium medrol. An immunosuppressant blocks the immune system, and it prevents the rejection of transplanted organs. Cellcept and Neorol are examples of those. And then a protease inhibitor drugs are drugs that inhibit protease, which is an enzyme that is needed for viruses, especially HIV viruses, to reproduce. Sirixavan and Fortovase are two of those. And then your reverse transcriptase inhibitor drugs, they inhibit reverse transcriptase, which is an enzyme that is needed for viruses to reproduce, like Epivir and Retrovir, and these are also used for HIV. Most of the drugs that target viruses have been developed for HIV, and there are also some that have been developed for flu, but we don't have a lot against viruses. All right, that wraps up our video on diagnostic and therapeutic procedures. Thank you.